I'm going live as we speak, and then I will have to do a little bit of things. Go away from that. There we go. Are we face? Yes, we are now streaming live on the If You Could See Me Project Facebook page. I was very impressed at my surgerizing of our pictures, so it made it look like you and I were standing like right next to each other on stage.
Not a big fan of that picture.
Sorry. You could have told me that, and I would have.
It's fine.
Moved it. I would have made it be different. Hold on,
Just because I look chunky monkey.
You look beautiful. I loved that dress. I love the look on your face.
Haven't worn that dress since.
Yeah. Well, who wears dresses anymore? I don't remember the last time I wore a dress.
I don't know.
Join me and at Pamela on the I say this every week. One day I will bring somebody in here to do all this technical stuff, but so that I don't have to do two things at once. But I actually kind of enjoy the process of, doing all the technical stuff. So, la la la. You're so patient. So wonderful.
I've had to learn.
Don't we all? Don't we all? All righty. Welcome, friends and family, to another of our weekly Saturday morning conversations here on If You Could See Me Project Facebook page. These conversations are had with members of our If You Could See Me family. That includes participants, past, present, and future, professionals in and associated with the mental health field, peers, and other doers of this work in their own way. We are here to change the conversation around mental health and to eliminate stigma, to learn to internalize our stories in new and more positive ways, and ultimately to take shame off the table. I say this every week, and I will continue saying this every week. What if shame was no longer an option? What if we chose not to accept it as the truth? What if we chose to rebel against it as a tool for control, both for ourselves and in the world, in our systems, within our families, within our workplaces? And that's what I mean by taking shame off the table. In the negotiation around the boardroom of my life, shame is no longer an option. And I invite all of you to join me in that revolution. Today, that we are here to talk about a topic that I was first introduced to by today's guest back in 2018. It's hard to imagine that I had never heard of complex post-traumatic stress disorder before Pamela told me about it. But it's even harder to imagine that it could be a controversial, confusing diagnosis that is still not widely used or understood today. I'm excited to be joined by Pamela today. Pamela is a survivor and a person who lives with complex post-traumatic stress disorder, but she is also a professional who works in the mental health field, helping people overcome their own trauma, and who also works as a certified sex offender treatment professional. We have so much to talk about. Before I bring you in and we jump into this conversation, I just want to introduce sort of the concept of complex PTSD to our audience, just so people are sort of coming in on an even playing field, because I think that a lot of people don't understand what it is. So this information comes from the National Center for Post-Traumatic Stress Disorder. Complex PTSD is similar to traditional PTSD in many ways, but many traumatic events are of time-limited duration: car accidents, natural disasters, things like that. However, in some cases, people experience chronic trauma that continues or repeats for months or years at a time. Some have suggested that the current PTSD diagnosis does not fully capture the severe psychological harm that occurs with prolonged, repeated trauma. Treatment considerations for those with such complex trauma histories are being reviewed. And this looks like complex PTSD will, become its own diagnosis in future iterations of the ICD and the DSM. So the history of the complex PTSD diagnosis is that in 1988, Dr. Judith Herman of Harvard University suggested that this diagnosis was needed, which describes symptoms of long-term trauma, such as, according to her, behavioral difficulties, which include impulsivity, aggressiveness, sexual acting out, alcohol and drug misuse, and, quote unquote, self-destructive behavior, emotional difficulties, cognitive difficulties, interpersonal difficulties, and somatization, which is, involves the body and, sort of medical co-occurrences. Pamela, first of all, thank you for being here. Thank you for agreeing to be a part of this conversation with me today. I want to start by, giving you the floor, but I want to kind of put this out there, okay? That, the way that I see it is that complex post-traumatic stress disorder is not, a consideration in many ways because we don't understand trauma. Mm-hmm. We don't accept and acknowledge what can be trauma or traumatizing or traumatic. And in many cases, it, I come from everything, sort of through the lens of feminist theory. And, we don't acknowledge trauma toward women. We don't acknowledge trauma toward marginalized populations in many cases. And as a result, certain behavior has been pathologized in a way that is not helpful. And we don't consider trauma as widely as we should. So that being said, I just talked for many, many minutes. I love and adore you. Thank you for being here. Welcome welcome to the show.
Ta-da!
Yes, the curtain has opened.
My cat is joining us today. Well, one of my cats.
I love that. We love family pets on this show. If my dog would sit with me and not bark at everything around her, she would be here as well. So welcome. What is your cat's name so we can welcome him properly?
This is Brutus.
Brutus, welcome to the show. I look forward to hearing your point of view.
He weighs 23 pounds.
23 pounds?
Yeah, he's a big boy.
So my dog weighs 11 pounds. So your cat would sit on my dog and cause harm.
He's had enough. He's finished now.
I've offended him.
Bye, Broody. See you later. He got fat shamed, and now he's.
I just was gonna say I body shamed your cat. I apologize.
He is. He's very sensitive.
Yeah, crazy.
So I, I'm not a morning person, which kind of has to do with my journey with complex PTSD. Mm-hmm. Is some days I'm so tired from my brain, overworking and being hyper vigilant all of the time and having to be aware of my surroundings all of the time, and it's exhausting. And so there are nights where I stay up until 3, 4 o'clock in the morning. Even with my, medications, it's still hard for me to go to sleep. And then I'll sleep until 1 or 2 o'clock in the afternoon some days if I'm not feeling well. And people, like, they say that's not a normal sleep schedule. And I have a problem with that, because my parents even say, they're like, that's not normal. Like, normal people wake up at 7 a.m. and go to bed at like 10. And I say, I don't think that that's appropriate to say there's a normal sleep schedule. Now, are there sleep schedules that can benefit someone's health if they're not getting adequate sleep, or their sleep is ruining their ability to be productive at work or anything like that? But I don't think that not like having an alternative sleep schedule should be stigmatized into saying that we're lazy or whatever the case may be. So that kind of ties into my daily life of fighting against myself. It's a constant battle, fighting with myself against this diagnosis and trying to live a normal life, which I've never done. I mean, I don't even live a normal life now. I have my own practice. I work from home. I have clients that come, and I have new clients, old clients, clients that don't stick around, because that's part of the mental health field too. And so my schedule is always changing. So I don't have a normal life. I don't even know what that means.
Right.
I don't think we should care about that. And
is your life fulfilling? Are you happy, as happy as possible, right? Like, are you getting where you need to go? Are you achieving your goals? Those are questions, rather than are you normal? Are you fulfilling some global expectation of what you're, supposed to do, want, and have?
I'm like, what am I supposed to do? What would you have me do?
Right.
I constantly struggle with, I was talking to, because every good mental health professional needs to have their own therapist. And if they don't go to them, because you can't assist others in handling their mental health without handling your own as well, like working through that as well. So my therapist and I were talking about, the other day we were discussing my motivations behind me continuing to gain education and push myself to be better than I was yesterday and all of these things. And that's tied in directly to my complex PTSD, because in my mind, people who don't know my background, as a survivor of sex trafficking and sexual trauma and emotional trauma and physical trauma, I have constantly felt survivor's guilt, and that if I'm not continuing to push myself and be better than I was the day before and get all of these educational degrees and all of this stuff, then I'm nothing, right? Because they couldn't do that. And so if I'm not, pushing myself and I'm not doing all of these things, then, why am I allowed to be alive when they're not? And so that's something that I struggle with on a weekly, monthly basis, is imposter syndrome, and saying, I'm not good enough. I'm living a lie, I'm not well, and all of these things. And so that's really difficult to work through sometimes. And I'm not ashamed of that. I'm not ashamed to talk about my shit. You know that. It is what it is, man.
Well, it is what in many ways gives you the perspective that you have, that gives you the ability to show up for people in the way that you do. That's not to say that you couldn't have been a mental health professional and been very effective at it. And, you don't need to have survived what you have survived in order to be effective. However, what you have lived through has provided you with a very specific lens.
Yeah.
And there's value in that, so to have shame in it doesn't serve you or the people that you work with.
Right.
But at the same time, shame in this case is sort of the baseline, right? Like when you're dealing with this level of trauma and existing within this diagnosis, that sense of shame is pervasive and ever present.
Mm-hmm.
Can you talk a little bit about that and about, especially since, I start this show with, we're taking shame off the table, as if we can just decide to do that and then poof, it's done. Right? And anybody who comes to this space and, wants to give me the old fuck you for that, I get it. Right? Because I'm not suggesting that it's easy or that it's even entirely possible.
Mm-hmm.
However, it is, I think, something that we need to talk about. We need to talk about, what's the difference between shame as a mental health response to certain things and shame as a tool that's used for, control and hurting. I see it in schools all the time. I see it in, in families all the time. And so, I feel like it's important to really kind of pick it apart.
Yeah, and shame is also tied into something that's held people with mental health issues down for so long, not just by society, but by if it's an individual who has harmed them.
Yeah.
Or multiple individuals or whatever. One of the main markers of abuse is being taught to be ashamed so that you don't speak up. Mm-hmm. You're gaslighted into thinking that you're the problem and you're ashamed of yourself. Mm-hmm. And so it's tied into all of these things. And we say, well, if I admit that I am shameful to myself, then that continues to keep me down from sharing my experience with others. And that's the cycle of people not receiving adequate health care, is that you don't want to say anything because you don't want to be seen as somebody who can't live in this world because you have a mental health issue. And I think you would be hard pressed to find a person who doesn't have difficulties with existing in everyday life.
Yeah.
If you can find a person who doesn't, there should be studies done on them to see like what is like what makes you special.
Right. What's the magic serum there?
Right.
What's the magic brain chemical and can I get some?
Yeah.
Right.
I lived in shame for so long that because especially with being a survivor of trafficking, there's such a stigma behind that, because immediately when you say that, people think that, I hate this term, but people think that you were a prostitute and that you chose this life and that you chose to be hurt and all of these things without really analyzing, what are the words, Erin? The depth that goes along with this term. It's not, there's so many layers of, the term sex trafficking and human trafficking and what that means. And until that's my fight, until people begin to realize that survivors of sex trafficking are victims and that they should be treated as such and not jailed and not, put in this box of, you know, somebody said to me one time, and this is, I don't know if, I know you don't care, but maybe this is too much for social media. One person one time when I disclosed that I was sex trafficked, they said, oh, you were a whore.
Oh my God.
Of course, if I had not been in therapy, I would have chose violence. But instead I tried to take that opportunity to educate them, and tell them about themselves. And that's what I continue to try to do in the face of hate, is trying to educate people rather than take that anger and resentment and put it within myself.
Right. And, you know, it's really, you know, the idea, one, sex work as a whole is a thing.
Right. Yes.
Right. And should not be shamed at all.
Right.
Provided that it is consenting adults entering into a consensual experience together.
Yes.
Right? A thing.
Mm-hmm.
You were a child,
Mm-hmm.
not able to make that consensual decision for yourself. No child is able to make that decision and understand the magnitude and the consequences of it.
Mm-hmm.
You know, so even if a child is not being threatened and forced into that world and thinks they are making, that is still a victim. Yep. Right? And so there are so many layers to this that, nope, it's too scary. It's too shameful. It's just sex bad, sex scary, sex wrong, sex done in the dark, sex no, that we can't even understand, you know, what we are trying to uncover right here and having this conversation. That this is so huge. It is so far beyond you're a prostitute or you're a whore. I mean, good Lord, what kind of people?
Yeah, you'd be surprised.
But like, if nothing else, we can have this conversation in this space and say, y'all, like, open your minds and your hearts to the reality of the world. Like, if you learn nothing else from this conversation today, learn that what you perceive as true is very often not.
Right.
And like, learn some shit. I love you all. I do. And I don't want to be nasty, but good Lord, have some friggin' compassion.
It's really easy for people to say, nope, I don't want to see that. I don't want to look at that. I don't want to think that that's true, because then they have to come to terms with there is extreme evil in the world. And there are people who have to face this evil when others don't. And, you know, a lot of people think, going back to sex work, a lot of people think that because I was trafficked and because I have complex PTSD and stuff, that I don't support sex work. And that's the opposite of true. Is I am one of the biggest supporters of, like you said, consenting adults entering into a field of work.
Yes.
Because it is a field of work.
Yes.
And, you know, that's how they choose to express themselves and make a living. And I fully support that.
And they should be safe, and they should be protected, and they should have, you know, be able to pay taxes and be part of the world, and, you know, all of those things. Yeah. Because shame dies in the light, right? Like, when we can step into the light and say, this is an honorable form of work between two consenting adults, then we don't have, at least not to the magnitude that we currently have. I'm not naive. I realize the world is filled with evil and bad shit happens all the time, but we don't have the opportunity for this level of darkness and horror to continue if sex work is a thing that can be done safely and in the light above board, and
Yes.
and people don't have to put themselves at risk, and these traffickers don't have the same market for what they're doing, except that children trafficking is always a thing, and that we have to continue to be aware of and fight against.
Yeah, being in the realm of choosing sex work as a career, and I think it could be a whole career. Do whatever you want. I don't care. I love and support those people. But what I think is an awesome tool of empowerment too is that if sex work were more prevalent and accepted by society, is what I should say, is that it would then open the world up to see this good, this respectable, this crime, violence, this bad. Like, if we can acknowledge both, I think that would be incredibly helpful. I think one of the biggest things that keep people from wanting to recognize trafficking and all of these things is, how do we stop it? I don't want this bad thing to be here. How do we stop it? And, my response is always, I would love to eradicate trafficking.
Of course.
Is that ever going to be possible? I would like to think so. But am I also a realist and know that even if we don't necessarily see it anymore, which it already goes unseen a lot, it's still going to happen. We can't dismantle an entire underground of, this kind of crime level, just like we've never been able to eradicate drug problems. We've never been able to eradicate gun trading. All of these things, sex trafficking goes along with those things most of the time. And I want to live, Erin, that you call me a cynic all the time, and I love you. But that's also a part of my PTSD.
Of course.
I am not, my brain doesn't allow me to live in a world that I can be fully optimistic and happy all the time. And I do try to work through that on a daily basis. I try to give people the benefit of the doubt. I try to be more trusting of people, but there's that part of me that has to put up these, barbed gates. Because life has taught me that if I don't, then, I could die. And so I forgot what I was talking about, as I do. But the main point is pushing education about sex trafficking is like my number one priority in life. But it's very difficult. It's very difficult to get people to recognize that, how prevalent it is, and that people do go through these horrible things. And, they say a lot of people who will listen ask me, well, what can we do to help? And I say, support organizations that are working to help survivors in trafficking be aware and educated about trafficking. Those are the biggest ways that you can help. You can't go in guns blazing, into a place and try to save everyone, because that's not a good idea. But do everything you can to educate yourselves and others around you, because the minute that we stop talking about it is the minute that they continue, these, horrible people continue to gain
power, control.
There it is.
And I have to defend myself for just 1 second. The only time that I have ever called you a cynic is when? When you didn't want to do what?
Sing a Wonderful World song.
Thank you.
Because you know that I just...
hate that bullshit, and I get it so much. But I like
know.
the schmaltzy, and I want us to end our shows from that place of hope.
And I respect
And
that.
If You Could See Me is all about, stripping away a little bit of that barbed wire enough to be able to access the story and for us to be able to connect with one another.
Yeah.
And so you're not cynical at all as a human. I mean, the work you do couldn't be anything further from cynical. You're just cynical when it comes to singing schmaltzy American standards that you think are stupid.
I'm fair,
I'm cool with that, because you always show up, and whether you're actually singing or not, your mouth is moving. So
to me, it's akin to like sitting around a campfire and be like, kumbaya.
Yes. And I feel that it's necessary to have a kernel of that. There is the kumbaya is a necessary, if not small, part of what we do together. Because I mean, hope is hard.
It is.
And it takes a certain amount of that kind of like suspending of our cynicism and putting ourselves out there in the world to be a bit of a sponge.
Mm-hmm.
And I just, I appreciate you and your willingness to do that, and your willingness to, put aside the surface level discomfort of that. Because what's true is that you standing on our stage and telling your story more than once, like quite a few times at this point, is way less cynical than whether or not you sing What a Wonderful World at the end of the show, right? Like, you show up without cynicism because you choose to do that brave fucking thing.
Yeah, so. And I think one of the reasons that you've made this wonderful space is because you are able to open up those balancing, talking about really difficult mental health issues while also providing hope to other people and making that space feel like that. I don't think I could do that. I really don't. I'd probably end the show with like metal or something. Be like, what happened? What's happening? This took a turn.
Well, there's more than one way to do this the right way. It's just a matter of, of what works for who's in the room. And, this is my way. It's not necessarily the way. It's just my way. So, we got a few people joining us on Facebook, and I just want to acknowledge their presence here. Robin Matthews says, Pamela, thank you so much for your courage to share your story, and to Erin for raising the awareness of how this relates to complex PTSD. And our darling family member, Calendria Arroyo, says, good morning, ladies. Good morning, Calendria. It's so wonderful to have you here as part of this discussion this morning. Yeah, so talk to me about when you first heard the diagnosis of complex PTSD and what that meant to you, because I remember when we first met and you said, I have complex PTSD and that is different than traditional PTSD. You have to know that, you have to be aware of this. And so this sort of started me on along the path of like knowing what complex PTSD is. I presented last year at the Virginia Counselors Association with using your story as part of my presentation about how narrative therapy, which is, what we use in the If You Could See Me project, can be beneficial as part of the sort of treatment interventions for individuals with complex PTSD. So talk to me about the diagnosis for you and what it meant to you to have it, how it helped you understand yourself better, and, anything else you feel like is relevant.
Yeah. When I first fully got into, what I call treatment, it was, not like not like I went to a, rehab facility and received treatment, although probably sometime in my life I probably should have. Um, um, I went to a psychologist that I respect dearly, and saw him for about 6 years. And in the beginning, when we were talking about stuff, I wouldn't talk about what happened to me for months. Um, but when I finally did, I always thought that PTSD was reserved for members of the military and, former um, members of the military. And that is still something that society believes. Um, and not to diminish that, but there are many, many people within the world who've experienced, trauma, whether, like you said, it be one instance of trauma, like a car accident or something like that, and they have PTSD because of that. But like you said, it lasts from, basically it's described as lasting between 30 days and at the most 120 days. So it's a really weird, like, this is a time limit. But when he talked to me about complex PTSD, I was like, what? I was like, first of all, you just told me about PTSD and how I have it, when I didn't understand that either. And now you're telling me that this is my brain at the time, I'm even more messed up, like, than regular PTSD because I have complex PTSD. And he said, no, all that means is that it's been a persistent, there have been multiple traumatic experiences throughout your life that have led to, PTSD that becomes a part of your everyday life. And complex PTSD changes the brain chemistry. It develops new neural pathways used to protect yourself and to push back memories and to do all of these things. Because what we know about the brain with PTSD is that, we have our prefrontal cortex, which tells us how to make decisions. And then we have the amygdala that tells us, when receives sensory and says whether it's a danger or not. And our prefrontal cortex is supposed to tell us whether we are actually in danger or not. So the amygdala is like, and our prefrontal cortex is supposed to be like, no, chill. It's okay. It was just a balloon popping or something.
It's not a bear.
Right. And in the PTSD brain, something happens, a stimulus happens, and most of the time you immediately go into fight mode or flight mode or freeze mode. And the front part of your brain doesn't have time to let you know that you are not in danger. So that part of the brain has changed, but then other parts of the brain are changed. And so on an everyday basis, you are constantly trying to combat, thoughts of, I'm not in danger, I'm not going to be in danger. If I encounter a situation where I could be in danger, how do I make decisions about that? And it's exhausting. It's like, and we talk about this all the time, that mental, psychological issues are exhausting. Mm-hmm. We're not running, we're not lifting weights, we're not doing any of this stuff, and yet we're exhausted. And it sucks sometimes because you want to be able to do so many things. Yeah. So when I first got diagnosed with complex PTSD, I was like, great. Like, not only am I hurt, not only am I scarred, but now I have to live being different than other people and explain to other people when I have triggers and stuff that I'm not crazy, And so it took me a very long time to adjust to that diagnosis and what it meant for my life. But then, like, opportunities like this and my own education goals and things like that, I slowly started to embrace. my complex PTSD and say, this is just a part of who I am. And it allows me the opportunity to talk to others about how you can live with complex PTSD and you can still reach your goals and you can still help others. And, you know, you can still counsel others. You can be anything that you want to be. And, you know, so I'm very grateful for the person who first helped me with, you know, overcoming those first severe issues and to educate me so that I could educate others.
What was most meaningful for you in that initial therapeutic relationship? And then how has, you know, what works for you in therapy changed over the years? Or has it?
What was the first question?
So what was most meaningful for you, like in that initial space? Because I think there are a lot of people who enter into therapy wanting to be in therapy, but it's too scary, it's too hard. The therapist relationship does not develop because of, you know, the complex PTSD, right? It's hard to establish relationships. It's hard to trust that people can be good. And that's part of complex post-traumatic stress disorder. So what did you get from that therapist that helped you feel like you could begin to open up?
Well, I surprised myself because he was a male.
Right.
Which, oddly enough, it's so backwards to what people might think, is even though it was men who did most of the harm to me, I actually had more difficulty relating to women.
Right.
I saw them as a threat to me. And I saw them as bringing up feelings that I did not like from watching other women get harmed. And so I didn't have a trust of women. So that's kind of backwards. But I liked the fact I needed someone who wasn't just going to sit there and be like, okay. Like, because I wouldn't feel heard. And all I ever wanted was a voice and a space to feel safe enough to like yell and tell my story and get it out, because that's what was harming me the most, is not being able to tell anyone. Because I couldn't tell my parents. I couldn't tell anyone. And so he was the only person that made me feel safe enough. And that took a long time for us to develop that relationship. But he allowed me the space to do so, to develop trust with them. And he asked me quite frequently, is it okay if we talk about this? Yeah. And if it's not okay, what would you like to talk about? So it wasn't pushing, you know.
You were in the driver's seat.
Yeah. And that's kind of what I do with my clients.
Right.
You know,
I think it's really interesting that you mentioned that. And I think, you know, if there are any, you know, therapists or, you know, peer support folks or professionals, you know, that work in these spaces, understanding that, you know, I think that people want change or want rapport to be built within a certain you know, they have an expectation that within 4 sessions we should have built, you know, a certain amount of rapport, and we should be, you know, and 4 is random, you know, obviously we all do things differently, but you know, that this should happen relatively quickly. And understanding for a professional that when it is not happening as quickly as you think it should happen, or you would like for it to happen, that does not mean that it's not going to happen. And that does not mean that work is not occurring. Right. You know, that an individual such as yourself, or, you know, in a similar, you know, with a similar set of experiences, continues to show up to therapy is indicative of there being, you know, that things are working to a certain degree. And like, we can't walk into, you know, things having an expectation that if it's not, well, I can't help you, or it's not working, or, you know, I hear that frequently from people who reach out to me and say, so-and-so said they couldn't, you know, couldn't help me. because things weren't progressing quickly enough, or that they, and or they can't provide me with the support that I need. And so, just like that as a reminder for all of us in helping professions, that even if things are moving slowly, and at times they really do, that doesn't mean that it's not working.
Yeah.
So I just thought it was important to point that out.
No, yeah. And one of the funniest things for me is the change that I had in how I viewed my life. Because there was a point in my life that, and it wasn't, I didn't want to be alive anymore, right? Because it was too painful. But then at some point, it switched to saying, well, I'm here and I survived through this and now I want to live. Mm-hmm. And so my eagerness to live outweighed the scared feelings that I had in talking to someone else. Yeah, I was scared as shit to talk to somebody else about my stuff, but I was more afraid of dying. Yeah. So that kind of like, which are you more afraid of? Like, so I'm going to do this other thing that's hard, but that's what I carry it to my clients in that, we can talk about whatever you want. You stated that you came here for a specific reason. We don't have to talk about that if you don't want to. And chances are is they will open up on their own by developing that trust and rapport and things like that. And another misconception that I think is often with counselors and therapists and psychologists is that every session you have to be talking about those psychological issues.
Right.
And sometimes my clients come in and we laugh the entire time. Mm-hmm. And we're just talking about whatever, because that's what they want to talk about today.
Right.
And sure, sometimes I will try to push a little,
right.
But I'm not demanding that they talk to me about anything, right. And I think that helps develop a sense of trust in that they feel like it's a safe place to talk about the hard things. Mm-hmm. And it will come, but they keep showing up. I'm gonna stay there. So I'm just grateful that they chose to share themselves with me. Yeah. And so even though it's mentally exhausting, because being present, that being present the whole time is really difficult, like draining, at least on my brain. Mm-hmm. It's weird. It's like, because I had a 2-hour session and then a 1 hour, I was sitting talking to people for 3 hours straight the other day. And when I finished, I was like, I don't want to do anything. And I felt so exhausted, but they weren't hard sessions. Right. It wasn't like we broke any milestones or like talked about really hard stuff. And I was like, man, why am I so tired? And then you realize like being present for that long is very difficult. Yeah. Is it rewarding? Yes. But is it very difficult? Yes, it is. Yeah.
Absolutely.
Especially for a mind that's muddled,
Yeah. Yeah. Well, that's why I think it is really important to understand, for us as professionals to be mindful of our own needs and our own, the way our brains work, and to process all of it, because it is, like there's nothing I want to do more than sitting in those spaces across from a person, helping them figure out the path, and what their journey is supposed to mean. And at the same time, like I need to know that at the end of that, there are things that I have to do in order to be able to show up again tomorrow.
Yeah.
And to have that self-compassion and to have that, that kindness to myself and that acceptance, that sort of radical acceptance that, I am also a human being with needs. And sometimes my needs are, and I don't have complex PTSD, but I do have, my own stuff. And sometimes my needs are more significant than others.
Right.
right? There are some days where my bandwidth is just is minuscule. And so, you know, there has to be this this real self-awareness. And that's why you said, you know, having a therapist for therapists and helpers in general, and really everybody, I think everybody should have a therapist.
Yeah.
There is no reason why you shouldn't have a therapist. Everyone should have a therapist.
I mean, you got something.
Well, I mean, because life is hard. Look at the influx of need for therapy over the last year.
Mm-hmm.
You know, as people have been forced to sit with themselves within their homes without the ability to really escape it. And, you know, we can only do so much, like baking of bread and rewatching The Office before, you know, you go, I got to deal with whatever this thing is that, you know, I've been filling with stuff out there, right, and going out and hanging out and, you know, all the things that we do to sort of escape life, that were no longer an option. And so a lot of us are faced with, you know, the need for therapy.
Yes.
The need for support. And so, you know, what's wrong with everybody just having a therapist that they can talk to occasionally? You know, people who have check-ins once a month and they're just like, I just want to like have accountability and make sure that I'm not getting too far in my own head and, you know, make sure that I'm maintaining, you know, my relationships, you know, like we go to the doctor periodically, or we, you know, we do maintenance on our bodies. Well, some of us do, some of us do not do that, but you know, that's a whole nother thing. That's a whole nother thing. But you know, we have like 10 minutes left in this discussion, and I want to hear you. I know it happens. It goes by really, really fast. I want to talk about, you know, being a CSOTP and what brought you to that. And, you know, a lot of people probably question your motivation for doing that, having survived, you know, trafficking, having been, you know, abused and assaulted in the way that you have been, working with individuals who perpetrate those types of crimes, you know, has got to be incredibly difficult for you. And, you know, just for our audience, you know, we have had some, you know, some sort of triggering conversations that I haven't really warned you about. But, you know, if you, well, yeah, you're not triggered, but the audience might be. So, you know,
I'm sorry.
This is where Pamela is going to talk about working with sex offenders and, you know, that sort of that experience, what motivates that, and, you know, what you get out of that.
One of the things I like to remind myself is to face the devil. And when I say the devil, I mean people who do horrendous acts. You have to arm yourself with knowledge, and you have to arm yourself with an attitude of, you know, regardless of whether or not I hold hate in my heart, it is my firm belief that every single person on this earth has a right to mental health care, has a human right to mental health care. That is my firm belief. Even the devil has a right to mental health care. And a part of what drove me to want to help treat sex offenders is that there are so many, the main consensus within society is that these people do not deserve to live. You know, so many times someone commits a horrendous act and it gets posted on social media and is in the news and stuff, and all of the comments are murder them, they deserve to be shot, set on fire, like, you know, all of these things. And I understand I can logically understand that immediate response. But I suppose that's not what I'm made of anymore. I'm made of the understanding that we can hate these people all we want to. But if you're not willing to be a part of the conversation and the push towards treating these individuals, then literally nothing's going to change. And if I can prevent one person from reoffending against another person or people, then that's worth it to me. I could hold hate in my heart for the rest of my life for the people that hurt me. Or I could try my hardest to be a part of the solution. And that's what I chose to do. That's a part of my healing process, is to put my efforts and my story into gaining knowledge and education and pushing towards healthcare for these individuals. Now, I also am not blind to the fact that not all of these people can be helped. Not all of these people are safe from, reoffending and especially violent offenders. I'm not blind to that. It's never gonna, just like trafficking and drugs and all this stuff, it's never going to be eradicated. But one person, to me, is what it's about. One person and then another person, then another person. How many people can we help? Because it's a sickness. For a lot of these people, it's a sickness. And we have to treat them like they're sick. Right. You don't go up to a meth addict and say, you deserve to die and you deserve to be burned up because of your crimes. We don't do that. And they're sick. So in my mind, anyone who's sick needs to be treated like they're sick and needs to receive mental health care because they're sick. And that's simple.
We throw people away.
We throw people away. And I understand, I am not a sympathizer. Right. I do not condone the actions of these people. But, through working with offenders, my best friend is a sex offender. He served his time. He's served 5 years in prison and he's been out for over a decade. And he continues to make living amends every single day for his crime. He has never reoffended because he got treatment. And a lot of people hear that and they're like, oh, you're friends with sex offenders? And I'm like, I'm not friends with active sex offenders. Okay. And I'd be the first person to report them. Right. And it's out of love, And it's hard for the mental health community to understand too, professionals. Mm-hmm. They don't get it. No. They consistently want to work with people with anxiety and depression, and that's it. And I'm not saying those aren't important things. I'm saying, but there are people who have to do the really hard stuff. Yeah. So that's about it. It is what it is,
Well, it is not what it is. It is so much more, and it is what it is my favorite saying. And my brother-in-law always says to me, except when it isn't. Right. And I hate when he does that because it always is what it is. Right.
Yeah.
But I do think that, looking at your experience and seeing the work that you currently do and seeing, this is a story of so much work, first of all, on your part, that you have done so much work and healing to get to this place, but also this incredible compassion and commitment to understanding the human condition, to understanding that, hurt people mm-hmm. without compassion, kindness, support, help, access, like pathologizing, can help it fractionally, right? But it doesn't get us where we want to go.
Yeah.
But when we see a full and complete person in front of us, then when we think about what that person may have experienced themselves that led them to this place, it allows us to sit in that space with less judgment, with less fear. That does not mean, again, like I want it to be really clear for everybody that, as you said, no one's condoning this behavior. Yeah. No one is suggesting that because a person has been hurt, they are justified in harming others.
Yeah.
However, it is important to understand why and how these things come to be, and not to throw people away, but to do the very best we can to help them overcome, to help them be like your friend who is now, I love that, living amends every day, like trying to make it right, trying, not living in that dark, shame-filled space where you don't get help because that would require you to admit there was a problem.
Right.
So admitting that there's a problem, getting the help that you need, and then living in, a place of truth and honesty and light, and trying to make things right to the best of your ability. You cannot erase the damage that is done.
I mean, you want to talk about shame and guilt holding a person back from getting care.
Right.
And one more thing about offenders. Number one, we treat murderers better than we treat offenders, which in my mind I think it all goes back to our uncomfortableness talking about sex in general. Mm-hmm. So when you add that to a criminal act, it hits us way more personal than murder does, which is surprising. But also, this is not just my heart. This is scientific evidence, empirical studies that have shown offenders who receive treatment have a 9.3% recidivism rate, which is super, super low. Individuals who don't get treatment have a 35% recidivism rate.
Right.
So it's actually real work.
Yeah.
There is a difference being made if treatment is given to these individuals. So it's not just me saying, like, they can get better. It's not, it's science too. So
absolutely.
Yeah.
Thank you. As always, for your courage, you're so fucking brilliant. You're just so smart. And I love talking to you. And I love your brain, and I love the way you think, and, how incredibly, you always make me better. You always make me know more and feel smarter. And, I'm just deeply honored to have you as a part of our family. I'm deeply honored to, and excited that you are a part of this mental health provider community now, that we can share resources with one another. And, I just, there's so much that can be learned from you, in so many ways. So thank you so much for being here.
And thank you for being to blame for constantly softening my heart. This cold heart is consistently warmed by your amazing sweetness and your ability to trust others and see the good in the world.
Oh, what an awesome thing to hear on a Saturday morning. Thank you so much. I love you immensely. Everybody, join us again next week. I have to admit, I don't remember who's on, but I'm sure it will be fantastic and heartwarming and educational and informative, as it always is. Everybody have a wonderful week. Love yourself, love your people, and I'll see you soon.